Hello, Dr. David McFadden here from the Dental Implant Center in Dallas, Texas. We get a lot of questions about this topic, and I make such a big deal of it in all of my videos about implant bridges versus implant dentures or all on four. And having pink on your dental implant prosthesis, some of that's in our control and some of it's not. And I wanted to just go through that specifically today to talk about what we control and what we can't. So the first thing I would tell you about the pink is that in the all-on-4 protocol, the pink is mandatory because of all the bone they remove at the beginning of the surgery to make every patient the same, to make it a production line operation. And so the pink on the prosthesis, you have to have 100% with all-on-4. In implant bridges, our goal is always to have no pink, like you see here. So a patient comes in with pretty good tissue and pretty good bone, and some of their teeth or all of their teeth, almost always we can get them back to a point where we're just giving them teeth. This is our goal on all of our patients. Like you've seen in some of my other presentations, if they have the bone and the gum tissues, we're not touching it. But in some cases, you may need bone grafting. And if we get lucky and we can manage things well along the way and you heal well, sometimes with bone grafting, we can give you back tissues that you were missing and not have any pink on the prosthesis. Harder to do on the bottom. I talked about this in another lecture. Lower teeth are smaller. The bone around the teeth is called dental alveolar bone, and it's only there to hold teeth. So teeth are small in the lower front, and so is the bone. So we do have to remove a little bit of bone to get down to a platform that's wide enough for implants. Not always, but more often in the lower jaw. The upper jaw, our goal is no pink ever. But on occasion, patients have to have pink. And that's what I want to explain today is why. So in this particular case, it was done 5-6 years ago before I started the staged implant approach, where we keep some good teeth, put in half the implants at the first surgery, the second half of the implants at the second surgery, but we always have teeth that are supporting a temporary. That way we never get any negative change or blunting of the bone and the gum tissues. So that is in my control. Not giving patients a temporary whenever possible. Not giving patients a denture temporary whenever possible is a really strong benefit, long-term benefit to the tissues in the bone. People that come in with existing bone loss, we can't fix that easily. So those are patients who are going to have some pink on their prosthesis. Patients with lots of bone loss, no way to replace that. So you're going to have some pink on your prosthesis. And this is a case that I learned this on. This young lady had to wear a denture for 2.5 months while she healed. And that's how much of her tissues changed in that 2.5 months. Now with my new protocol, we should be able to maintain all those tissues like they were when we started. And then patients who have no good teeth and existing bone loss, they're going to have some pink. Now, patients with massive bone loss, pink is inevitable. So here are the 3 primary reasons that patients do need pink on their dental implant prosthesis. You already have significant missing bone like that gentleman. You have worn a denture. Now, you may not have significant bone loss, but just the fact that you wore the denture for any length of time, those little beautiful pink triangles of tissue called papilla, they're going to be blunted and they're going to be gone. And you have no good teeth for stage treatment. like the last gentleman that I just showed you. The papilla are what are so important. So we've got great respect for the papilla. And if you have them coming in, we should be able to keep the teeth. We should be able to keep keep you from having pink tissue on the implant prosthesis. Just to go back over this again, patient with severe bone loss. He's already missing 60% of his bone and all his papilla. So patients like that have to have pink. But again, I'll reiterate, I said this time and time again. Just because you have pink on your prosthesis doesn't mean it's not an implant bridge. Now, all-on-4 is not an implant bridge. It's an implant denture. They took away your bone to start with. That's why you had to have pink tissue. They put angled implants in that required angled abutments. It's an implant denture. This is still an implant bridge because it still fits on the implant the same way. Very clean, hygienic connection. Our contours are convex, unlike all-on-4 where they're concave. You can clean these yourself. In fact, what I understand now is that many of the all-on-4 centers are having patients in once or twice a year to take their prosthesis out to clean it. That's their solution for creating an uncleansable prosthesis. Oh, and by the way, you're going to pay for it too. The problem with that is when you've got a concave tissue surface, within a week of your cleaning, it's going to be filthy again. So there's another insane part of that protocol. This will be convex. You'll be able to clean it. And like I've said before, I've been developing this technique for 30 years. We almost never have to take these out. And when I say never, I mean patients that I treated 30 years ago with similar protocol, they've never been out of the mouth. So they literally perform like natural teeth. And you can keep them clean easily. It doesn't take a big effort. So if you had to wear a temporary denture or even a permanent denture, that's the other way that we don't have the ability to preserve those tissues. I've showed you this patient before, and she did wear a denture for 2.5 months, and most of her architecture was gone. Certainly the papilla that should be all the way down here are gone. So we ended up having to do a small amount of pink on her. Doesn't affect her smile, doesn't affect her cleaning, but the staged implant approach is how I've solved that problem for patients with some or most of their teeth. And then we also have patients where we can't do the staged approach because their teeth are too far gone. Those patients, they have one lucky outcome, and that is that their bone density is high enough and the implant stability is high enough that we can give them the fixed temporary on implants at the first surgery. If we can do that, we can maintain some of their tissue even though most of it's gone already. Certain patients have such good bone or dental genetics that we can recreate those papilla out of your own natural tissue in some rare cases, but I would never promise that. So again, he had to wear a denture for 2.5 months, resulted in some pink on his prosthesis. And it started with his temporary. I knew right then that we had to have some pink on the final prosthesis. So to summarize, I'm going to tell you that our goal here in the upper arch, no pink whenever possible. And we are going to do everything in our power to maintain those papilla, the bone, and the tissues that are so precious. Lower arch is less common that we can do that because the bone is already so thin. But our goal is always no pink. But I wanted you to understand what the differences are. Know that our goal is no pink whenever possible, so that you had a better understanding of what I mean by pink on the prosthesis versus no pink. Little bit of it is in my control. None of it is in your control. You either have the bone and the tissues in the papilla or you don't. But we're going to do everything we can to maintain them or recreate them. So I hope that helps you understand the difference between pink fake tissue and no pink fake tissue. There's many other videos that you can find where I address this directly and indirectly. Thank you again, as always, for listening, and we look forward to seeing you back at our next video.